Greetings. I wanted to take a few minutes to first update you on the situation surrounding the Dossier Manor staff member who recently tested positive for COVID-19, coronavirus. And I also need to inform you that this morning, in a completely separate circumstance, we learned that a staff member from the Good Samaritan Center has also tested positive for coronavirus. In regards to the employee from Dossier Manor, on Thursday, April 16th, the employee sent notice that a friend's mother had tested positive for coronavirus, and he had spent some time with that friend, so he was going to self-quarantine and not come to work. The last evening the employee worked at Dossier Manor was Monday, April 13th. It is our understanding that later the employee began to exhibit coronavirus symptoms, and so he was tested. The positive result was learned yesterday, April 22nd, and we were notified. The staff yesterday promptly notified the residents and their family members, as well as the remaining staff at Dossier Manor. We have since also notified the general staff of ACV and informed you, the membership, through a letter and now this update. The local health department was also made aware of the positive test, and they have been most helpful to us during this challenging time. At their recommendation, we have asked the residents of Dossier Manor to quarantine in their rooms. We have also sent home to quarantine all employees who recently worked with the individual who tested positive. We made a request to the health department to have all of the residents and staff of Dossier Manor tested to help us get out in front of the virus. I am grateful that they approached the state on our behalf, and the state agreed to the request. In fact, they performed the test today for all Dossier Manor residents and staff. In regards to the staff member at Good Samaritan Center, a number of days ago, that employee learned that their spouse tested positive for COVID-19. They immediately notified us of a potential exposure. The employee lives in another county and thus contacted their local health department, who made the determination that the criteria requiring testing was not met and only monitoring for symptoms was needed. Due to the nature of our community and the number of reports that have declared that many infected people are asymptomatic, we decided, out of the abundance of caution, to pay to have the employee tested through a private lab. Due to our proactive actions, we learned much earlier than otherwise that the employee had contracted the COVID-19 virus. The employee has not worked in the facility since Wednesday morning, April 15th. Again, we have notified Good Samaritan Center residents and their family members, as well as the staff, of this discovery. We again notified the local health department, ACA, and the CDC. We are also working closely with health officials on this case and following their directives. The health department has again been most helpful, and I am grateful that they have requested the state to test all residents and staff of Good Samaritan Center in this case as well, and the state has agreed. They are scheduled to be here tomorrow to test all residents and staff of the Good Samaritan Center. Words cannot express my gratitude for the way the local health department has been of assistance and the way the state has responded. It is amazing that in both cases, testing for all potentially involved has occurred within 24 hours of the state receiving notification of a positive case. I'm especially grateful considering the fact that neither staff person has worked for over a week. And praise God, at this time, no resident of either facility is exhibiting any signs or symptoms of COVID-19. Be assured that as you have seen with our response in independent living, we are working diligently to follow proper procedures to limit the spread of COVID-19. For several weeks, all residents and staff of Dossier Manor and Good Samaritan Center have been screened, monitored for COVID-19 symptoms, and they have all had their temperature taken multiple times each day. Let me reiterate, at the present time, no residents are exhibiting any symptoms of COVID-19. Also, please know that we will continue to closely monitor the situation, and we will continue to work carefully with state health officials and follow protocols as advised by the CDC, the Agency for Healthcare Administration, and the Health Department. Over the past month, we believe we have employed all appropriately recommended government and health department prevention measures, and we will continue to monitor and follow all such directives. Both employees will be unable to return to work until cleared by medical officials. Let me end with this. As we have encouraged for some time now, it is important that we all continue to follow the guidelines of health officials. We will continue to work diligently on our end, but you can help yourself by continuing to take this pandemic seriously. Please limit visits. Stay home except for essential needs. If you must go out, maintain proper distances, wear a mask, and follow good hygiene practices. We remain in this together. Please join me in praying for a full recovery of these staff members and for the safety and protection for each of us who lives and serves here in Dowling Park. As always, for questions pertaining to your specific situation, please contact your service coordinator.